after years of working in the birth industry, I have found that it's not focused on or stressed enough how important it is to really pay attention to the soft tissue. We talk a lot about the relaxin that exists in the joints that causes them to be loose enough to shift and move for the process of labor, but muscles are also attached to those points on the bone, and they need to be cared for. We talk a little bit about yoga and birth circles and other types of exercises, whether or not women could do exercises while they are pregnant, which of course they can. But even more than that, the care of the muscles is really important. And I think that there's a misconception that because movement is often awkward in pregnancy, that there is a feeling of vulnerability and breakableness in the body. And I would like to dispel that misconception. As somebody who's worked in the field of birth for 14 years, being able to loosen and soften the muscle tissue really allows the joints to be able to do what they need to do for the process of birth and allowing the baby to be able to get into the optimal position. I am going to use this as an example. First, we'll start. This is a female pelvis. Now, of course, the actual female pelvis has more movement in these joint areas, but there are a large number of muscle groups that are attached to different points on the pelvis, on the hips, and on the sacrum. And during the process of labor, because of the fact that we have really looseness in the joints because of that relaxin that gives those ligaments the ability to move more, the sacrum area is able to sort of move out. And we get a little bit of stretching here in the pubic bone area where the pubic symphysis is. And then of course, a lot of women will complain about pelvic pain, which is from a lot of the muscle groups that are attached here at the pubic bone. And this pelvis sits sort of like this, not straight up and down, but sort of this direction. Another important component is the way that the baby is supposed to enter this space. There's an optimal position so that the baby is able to sort of fit the bones of the skull, are able to sort of mold and shape to easily exit the body. And the one thing that we can easily do to support that process is stretching. So I would like to show you a few stretches that are very easy to accomplish. You don't have to have an in-depth stretching routine every day. It's not important that you commit to 20 or 30 minutes, but you could do these stretches anytime you start to feel the resistance in your body, anytime you feel a little bit wonky. And some of those stretches are going to incorporate opening spaces here where the diaphragm is and the rib cage area, which we tend to be very protective of when we're pregnant. But because of all that extra weight that is pulling on the front of the body, if you have a lot of growth in your breast tissue, there's also extra weight pulling forward on the shoulders. It's not focused on enough that we need to do the work to stretch open those pectoral muscles, those sternocostal muscles, giving that diaphragm that's constricted a little bit, that umbrella shaped diaphragm muscle, a little bit of opening. And don't worry, you won't tear anything if you do a little bit of opening in this space, and you won't hurt the baby. The baby is very protected inside of your body. The number one recommendation that I make, and we'll start with that, is just a little bit of cat-cow. Now, when you are pregnant, you don't want to exaggerate the cow component because you can injure yourself. However, with the modified cat-cow for pregnancy, it's good to curve your spine up and sort of pull that pelvis within, and then return to more of a flat back that's supported. Curving up this way, shifting that pelvic space, loosening things up, and then coming back to a flat back position. Make sure that you are not sinking into your shoulders this way, but engage them because you can also injure yourself that way. Make sure you're not hyperextending your elbows, but also engage those as well, and try to keep your hips and your knees in alignment. So again, curving up and then returning to a flat back. I'm not going to give you a recommendation on how many of those you should do. Do as many as feels comfortable to your body. It's really important with pregnancy to listen to your body. Twinges are not always alarming, but they just cause you to be more aware of what is going on and the movements that are happening in your body. A lot of women complain about those sharp stabbing pains in their pubic bone area. A very simple way to just sort of avoid this being an issue throughout the day is spending more time sitting with your legs crossed this way, and what we have now commonly called, if you have other children, crisscross applesauce. You can do this. You could also alternate and put one leg in and then straighten out the other leg. You could do this while you're watching TV or sitting on the floor with your other children, and just spend a little time leaning in one direction. Let's keep that spine not rounded, but engaged, leaning forward as much is comfortable for you. You could even do a little bit of twisting. Also, this is not going to hurt the baby, as much as is comfortable for you. And even a little bit of stretching this direction, as much as far as you are able to comfortably go. But you should feel a little bit of a pull in those muscles if you're stretching them properly. Stretching doesn't have to be a prolonged movement, but you could count 1, 2, and then return to resting. You could come back and count 1, 2, and that short stretch keeps your muscles from spasming in response if they are being strained a little bit, but will increase blood flow to those muscle tissues, which will allow them to function more effectively. Make sure that whatever you do to one side of the body, you also do the other side of the body so that you can feel balanced. A little bit of leaning forward, and then coming back up to rest. Leaning forward a little bit, making sure that you've got this leg as closely as you can to your thigh, your inner thigh. A little bit of twisting this direction if it's comfortable for your body, with minimal pulling and stretching. And then of course, stretching the left side of your body. And it will feel really good, but you've got your latissimus dorsi, which is attached to the top of your hip, the middle of your spine, right here under your scapula shoulder blade, and also right here in your arm. So when you do this stretch, that muscle, which is strained with the weight in the front of your body, gets a little bit of relief. Opening up some of this here, and you'll find that that actually really does aid in your ability to get a fuller breath. I think one of the things that many women tend to be hesitant to do are any type of chest opening exercises while you're pregnant. If you have a yoga ball or an exercise ball, which I recommend all pregnant women access, it gives you the ability to do supported poses. If you don't want to hold yourself up on your arms for extended periods of time, you can always lean on this ball. It's a little more restful. Make sure that if your balance is not very good, that you've propped it up with something, or get somebody to spot you and assist you in doing that. But another way that you can use this ball is sitting on top of it with your legs open. It's optimal if you have a ball that allows you to sort of have a 90-degree angle with your legs. This ball is slightly large for my height. Keeping that pelvic space sort of engaged, don't curve forward like we have a tendency to, which closes that space up, but engaging it helps keep your spine in alignment, helps keep that alignment good here with your hips, and allows your sacrum and your hips to sort of balance out. Doing movements on the ball, circular movements. I often tell clients that the movements that get the baby into the body are the ones that support getting the baby out of the body easily. And any of you can sort of use your imagination to think about movements that you could use on the ball to just loosen this area that we tend to keep really stiff throughout the day, especially if you have a job that incorporates a lot of sitting. As for back bends, I recommend you get a little bit of help with this. We're not going to go all the way back, but this pose is a really beneficial pose for a pregnant woman who's having a hard time getting a good full breath because of the constriction in her diaphragm. Being able to lean back this way, let your head rest on the ball, allow your arms to fall open. You can even alternate and put your arms over your head this way, and then think about relaxing your hips and allowing them to fall towards the ball, to curve and follow the contours of the ball. And stay in this position as long as is comfortable for you. Again, even for me, this requires some core balancing, so please make sure the first time you try this, you have somebody spot you to make sure you don't roll off the ball and injure yourself. Another pose that I find to be really helpful for a lot of the tightness that women experience here in the piriformis muscle and in the glute muscles from all of the looseness that is in these ligaments that are holding this entire hip pelvis juncture in place, is a modified pigeon pose. Depending on your flexibility and your ability to be able to get on the floor in a level space, it might be more helpful for you to do this over the back of a couch or on a table. But the goal is that we want to fold this leg forward in front of us. Again, do this on a couch, back of a couch or a table if you aren't accustomed to this type of stretch. You're gonna alternate between a 90-degree angle and then leaning forward. This 90-degree angle allows you to sort of isolate the glute muscles. But when you change this angle, moving the leg forward a little bit and curving forward, it allows you to isolate the piriformis muscle and lean into that as much as you are comfortable. Go as far as you are comfortable. Again, you do not have to keep that as a prolonged stretch. And then alternate and repeat the stretch on the other side of the body. There is another tool that you could utilize for some of these tight muscles that are happening. Oftentimes, we are dealing with lower back and hip pain, and we completely neglect to pay attention to all of the muscles of the legs, the hamstrings and the quads, and even our IT band. Again, all of those are going to have attachment points in this part of the body that is the key doorway opening for a baby to come out of your body. And so one way that you can do a little bit of stretching is you can incorporate using a foam roller. This also might be a good idea to have somebody spot you while you're doing this, but even just gently rolling out your hamstring muscles. Those hamstrings, when they pull tightly because they are carrying you around and your center of gravity is off and you have a lot more weight, can really contribute to lower back discomfort. If you're able to even get in and do a little bit of work on your IT band, this may not be the most comfortable stretch in the world, and you can experiment with different types of foam rollers, but also just giving it a little bit of loosening will help relieve a lot of the hip and lower back pain that you may experience. And one more time, make sure you repeat that on the other side of the body. When you are dealing with discomfort in this part of the body, we have our psoas muscles and our iliopsoas sort of muscle juncture that is right in here, and the psoas muscle sits internally, and it's not easy to access when you've got a baby here. We've also got the ligaments, the round ligaments that hold the uterus in place. There's a tendency to avoid addressing this part of the body, but unfortunately, we do get a lot of back pain because of the tightness of these muscles and how everything is curved and shortened this way in the body. So one way that you can address that without having to get in there with a massage, with any kind of poking or prodding movements, is just incorporating these types of stretches. And if you change the angle of your back leg, moving it around this way, you can work to isolate different parts of your psoas. This also feels really good on that inner thigh space. Again, making sure that your knee and your ankle stay in alignment so you don't hyperextend. You can come up this way, change the angle this direction, change the angle this direction, and isolate different muscle groups. I hope that was helpful as a way to start stretching, moving, and relaxing different parts of your body in order to alleviate some of the discomfort that comes from carrying a child within it.